Hey there, and welcome to our video on supplements for irritable bowel syndrome, or IBS. In this video, we'll be diving deep into the world of supplements and exploring how they can help provide relief for those struggling with IBS symptoms. We'll cover 5 key supplements: probiotics, fiber, peppermint oil, digestive enzymes, and prebiotics and synbiotics. By the end of this video, you'll have a comprehensive understanding of how these supplements work and which ones might be right for you. So, let's get started. IBS is a common digestive disorder that affects millions of people worldwide. It's characterized by chronic abdominal pain, bloating, and changes in bowel habits like constipation or diarrhea. While the exact cause of IBS is still unknown, factors like gut-brain interactions, increased sensitivity in the gut, and changes in the gut microbiome may all play a role. This is according to a 2021 review by Patel, published in the journal Clinical and Experimental Gastroenterology. Managing IBS often involves a combination of lifestyle changes, dietary modifications, and targeted supplements. But before we dive into the specifics of each supplement, it's important to note that while supplements can be a helpful addition to an IBS management plan, it's crucial to consult with your doctor or dietitian before starting any new supplement regimen. Some supplements may interact with medications or have side effects, so personalized guidance is essential. Now, let's talk about probiotic supplements. Probiotics are live microorganisms that can provide health benefits when consumed in adequate amounts. They're often referred to as good or helpful bacteria because they help maintain a healthy gut microbiome. Research suggests that certain probiotic strains may be particularly beneficial for managing IBS symptoms. A 2021 review by Patel found that probiotics can be an effective adjunctive therapy for IBS. The study, published in Clinical and Experimental Gastroenterology, highlighted that probiotics may improve altered bowel habits, abdominal pain, bloating, and gas in IBS patients. However, the review also emphasized the importance of matching specific probiotic strains to an individual's symptoms for optimal effectiveness. When taking probiotics for IBS, consistency is key. It's more important to take probiotics daily than to focus on the specific time of day they are consumed. Experts recommend allowing at least 4 weeks of consistent use to assess potential benefits, as it takes time for the probiotics to colonize the gut and exert their effects. While research suggests that combinations of lactobacillus, bifidobacterium, and streptococcus species can be beneficial for IBS, the optimal strains and combinations are still unclear based on current evidence. Some specific probiotic products with clinical evidence supporting their use for IBS include BioK IBS Pro and Culturelle Digestive Health Daily Probiotic, according to the Probiotic Guide Canada app. A 2020 systematic review and meta-analysis by Dale et al., published in the journal Nutrients, found that multi-strain probiotics were more effective than single-strain probiotics for improving overall IBS symptoms and abdominal pain. The review also noted that probiotics containing bifidobacterium species, particularly B. longum, B. bifidum, and B. infantis, showed the most promise for IBS symptom improvement. Next up, let's discuss fiber supplements. Fiber supplements, especially soluble fibers like psyllium, can help normalize bowel habits in IBS. Soluble fiber absorbs water and forms a gel-like substance, which can help soften stools and promote regular bowel movements. A 2014 systematic review and meta-analysis by Ford et al., published in the American Journal of Gastroenterology, found that psyllium was the only fiber supplement with adequate evidence for improving IBS symptoms, particularly for those with constipation-predominant IBS. The review also noted that insoluble fibers, like wheat bran, may actually worsen IBS symptoms in some individuals. When starting a psyllium supplement, it's best to begin at a low dose, such as ½ teaspoon, and gradually increase up to 1 to 2 tablespoons per day as tolerated. To prevent potential interactions, take psyllium at least 2 hours apart from other medications or supplements. Staying well hydrated is also important when increasing fiber intake to avoid constipation. A 2018 monograph by the American College of Gastroenterology, published in the American Journal of Gastroenterology, recommends soluble fiber supplements, like psyllium, as a first-line therapy for constipation-predominant IBS. Consul Organic Psyllium Fiber is one readily available psyllium supplement that can be found in many pharmacies and health food stores. It's important to note that while fiber supplements can be beneficial for some individuals with IBS, they may worsen symptoms in others. Working closely with a healthcare provider to find the right type and amount of fiber is crucial for successful IBS management. Moving on to peppermint oil. Enteric-coated peppermint oil capsules can act as an antispasmodic to relieve abdominal pain and bloating in IBS. The active ingredient, menthol, helps relax smooth muscles in the gastrointestinal tract. Peppermint oil works by relaxing the smooth muscles in the intestines, which can help reduce abdominal pain and cramping associated with IBS. The enteric coating on peppermint oil capsules is important because it prevents the oil from being released in the stomach, which can cause heartburn. Instead, the coating ensures that the peppermint oil is delivered to the intestines, where it can exert its beneficial effects. This is according to a 2016 study by Cash et al., published in the journal Digestive Diseases and Sciences. Peppermint oil is typically taken 30 to 60 minutes before meals, or 2 hours after. It's recommended to start with 1 dose daily and increase up to 3 doses per day if needed. However, those with significant reflux or heartburn should avoid peppermint oil, as it may exacerbate these symptoms. A 2018 monograph by the American College of Gastroenterology recommends enteric-coated peppermint oil for overall IBS symptom improvement. A 2016 randomized double-blind placebo-controlled trial by Cash et al. Found that IBGard, a specific enteric-coated peppermint oil supplement, significantly improved IBS symptoms, including abdominal pain, bloating, and stool urgency, compared to placebo. While peppermint oil can be a helpful addition to an IBS management plan, it's important to use enteric-coated capsules and follow dosing instructions carefully to minimize the risk of side effects like heartburn or anal burning. Next, let's talk about digestive enzyme supplements. Digestive enzymes help break down harder-to-digest foods to reduce IBS symptoms from malabsorption. However, the evidence supporting their use for IBS is limited. Digestive enzymes are naturally produced by the body to help break down food into smaller, more easily absorbed components. Some individuals with IBS may have difficulty digesting certain foods, leading to symptoms like bloating, gas, and abdominal pain. Supplementing with digestive enzymes may help alleviate these symptoms by improving the digestion and absorption of trigger foods. This is according to a 2021 review by Patel, published in Clinical and Experimental Gastroenterology. It's important to note that digestive enzymes are specific to the macronutrient they break down, carbohydrate, protein, or fat. So it's crucial to match the enzyme to the known malabsorbed nutrient for the best chance of success. Digestive enzymes should be taken immediately before the first few bites of a meal and used occasionally for known trigger foods rather than at every meal. Currently, there is limited research supporting the use of combination digestive enzyme supplements for IBS. A 2021 review by Patel noted that while some studies have shown promise for specific enzymes like alpha-galactosidase for gas and bloating related to legume consumption, the evidence for broad-spectrum enzyme blends is lacking. Working with a registered dietitian to identify specific trigger foods and find a targeted enzyme supplement may increase the likelihood of success. However, more research is needed to determine the overall effectiveness of digestive enzymes for IBS management. Finally, let's discuss prebiotic and synbiotic supplements. Prebiotics are non-digestible food components that feed beneficial gut bacteria, while synbiotics combine prebiotics with probiotics. However, the evidence for their use in IBS is mixed. Prebiotics are often touted for their ability to promote the growth of beneficial gut bacteria, but their effects on IBS symptoms are unclear. Some prebiotics, like inulin, may actually worsen IBS symptoms in certain individuals due to their fermentation in the colon, which can lead to increased gas and bloating. This is according to a 2017 systematic review by Wilson and Whelan, published in the Journal of Human Nutrition and Dietetics. Currently, there is insufficient evidence to recommend prebiotics for IBS management. A 2018 monograph by the American College of Gastroenterology concluded that there is low-quality evidence for the use of prebiotics in IBS, and more research is needed to determine their efficacy. Synbiotics, which combine prebiotics and probiotics, have been studied in 2 small trials for IBS. While both trials showed improvement in symptoms, the results were not statistically significant. Larger, high-quality studies are still needed to determine the efficacy of prebiotics and synbiotics for IBS. A 2017 systematic review by Wilson and Whelan found that fructooligosaccharides and galactooligosaccharides prebiotics did not consistently improve IBS symptoms in clinical trials. The review also noted that some studies even reported worsening of symptoms, particularly bloating and gas, with prebiotic supplementation. Given the lack of consistent evidence and the potential for symptom exacerbation, it's important to approach prebiotic and synbiotic supplements with caution. Working closely with a healthcare provider to weigh the potential risks and benefits is essential for those considering these supplements for IBS management. In conclusion, while there is no cure for IBS, certain supplements may provide symptom relief when used under the guidance of a healthcare professional. The strongest evidence supports the use of enteric-coated peppermint oil and soluble fiber like psyllium for managing IBS symptoms. Specific probiotic strains, particularly combinations of Lactobacillus bifidobacterium and Streptococcus species, have also shown promise in improving IBS symptoms. However, more research is needed to determine the optimal strains and dosages for IBS management. Digestive enzymes and prebiotics, synbiotics, currently have limited evidence supporting their use for IBS, and some prebiotics may even worsen symptoms in certain individuals. Ultimately, the most effective approach to managing IBS with supplements is to work closely with a doctor or dietitian to develop a personalized plan. If you're looking for high-quality supplements to help manage your IBS symptoms, be sure to visit nutritionmarket.com.au. There, you'll find a wide range of evidence-based supplements, as well as access to our virtual clinic with clinical nutritionists and naturopaths serving clients in Australia and around the world. Book a consultation today to get started on your personalized IBS management plan. And don't forget to hit that like button and subscribe to our channel for more informative videos on nutrition and health. While the information in this video is informed by research, it's important to remember that it should not replace advice from your healthcare provider. Some scientific findings may still be under investigation, and it's always best to consult with a professional for personalized guidance. Thanks for watching, and we'll see you next time.